Good morning, everyone. Today I'll be talking about indirect pulp capping. Let's start with the definition. It is a procedure where thin layer of carious dentin is retained in the cavity to avoid exposure of pulp, followed by placement of suitable medicament and restorative material that seals off the cavity and promote pulp recovery. So let's look at the indications for which we perform indirect pulp capping. The tooth, it should be vital primary or young permanent tooth, has deep caries that is close but not involving the pulp. Patients give no history of spontaneous pain or swelling, no signs of any radiographic pathology. Now let's look for the contraindication that we should consider before going into indirect pulp capping. Number 1, non-vital tooth. Number 2, tooth present with discoloration or mobility. Number 3, patient gave history of sharp pain, spontaneous pain or prolonged pain at night. 4, any signs of any radiographic pathology. Now let's look at what are the material used. Glass ionomers, they give a natural look, bond well to the tooth and also release fluoride. Resin modified glass ionomers, they are strong, more wear resistance, provide superior bonding than glass ionomers. Calcium hydroxide, antibacterial, promote healing and is extremely helpful in forming reparative dentin. Dentin bulging agent protects the pulp during the drying and impression taking stages. Mineral toxicity, aggregate glass. It is an antibacterial property and act as a strong sealant. So now let's start with the procedure. It is done in two appointments. The first appointment, we excavate all the caries with large round pearl until resistance of sound dentin is left. Rinse the cavity with saline and dry with cotton pallet. We place calcium hydroxide at the base of the cavity. Fill the rest of the cavity with temporary filling, and we give a next appointment of 6 to 8 weeks. This is a pictorial demonstration of what we do in the first phase of appointment. So we see the cavity, the dental pulp, healthy pulp, then excavate the cavity till the effective dentin, and then we place the calcium hydroxide and then we put the temporary filling. On the second appointment, we take the history of the patient and patient should not report no pain. There should be no radiographic signs of any pathology. Remove temporary filling and old carious dentin. Clean cavity and dry with cotton pallet. Place calcium hydroxide, place cement and restore with filling. Here is the pictorial representation of the second appointment where we remove the temporary filling and we clean it, and then we put the calcium hydroxide and we put the cement and the final restoration on it. Thank you. And this was the procedure of indirect pulp capping. Thank you.